Hello and welcome back. Thanks for joining us. In today's video, we are going to briefly talk about strokes. Strokes can happen at any time and lead to an emergency room visit. If you have experienced any of the signs and symptoms of a stroke, please seek medical care. We all need to develop a relationship with our healthcare providers. This means scheduling regular visits and checkups. Prevention is always better than treatment. As we progress through this presentation, we hope to enhance your knowledge about strokes. This could equip you with a basic understanding of strokes, which may enable you to save yourself or someone else. Now let's begin. Let us begin by covering the basic working definition of what a stroke is. A stroke is a medical emergency that occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting the oxygen and nutrients it needs. Brain cells begin to die within minutes. The severity of a stroke and the specific symptoms depend on which part of the brain is affected and how long the brain is deprived of blood. There are also different kinds of strokes. A ischemic stroke is the most common type and happens about 85% of the time. Next is a hemorrhagic stroke. This occurs when a blood vessel in the brain bursts, leading to bleeding, hemorrhage, in or around the brain, often caused by high blood pressure, aneurysms, or weakened blood vessel walls. Lastly is a transient ischemic attack, TIA, often called a mini-stroke, a temporary period of symptoms similar to those of a stroke. TIA doesn't cause permanent damage, but is a warning sign of a future stroke. Now that we have a basic understanding of strokes, let's go over some signs and symptoms of strokes. A stroke is typically in progress when you or someone else is undergoing sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking or difficulty understanding speech, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or lack of coordination, and sudden severe headache with no known cause. If you or someone else close to you is experiencing any of these symptoms, call 911 immediately or take them to the emergency room. This is a serious health condition that is time-sensitive. You must act quickly in order to help someone or yourself achieve the best possible medical outcome. There are different biological processes happening in the brain during a stroke. During an ischemic stroke, a blood clot or other debris blocks an artery that supplies blood to the brain. A clot forms directly in one of the arteries supplying blood to the brain, often due to a buildup of plaque, atherosclerosis. Or a clot or debris forms elsewhere in the body, often in the heart, and travels through the bloodstream to the brain where it lodges in a smaller artery. The blocked artery prevents oxygen-rich blood from reaching the affected part of the brain, causing brain cells in that area to die within minutes. On the other hand, during a hemorrhagic stroke, a blood vessel in the brain bursts, leading to bleeding, hemorrhage, in or around the brain. This happens about 15% of the time. There are several ways this can happen. First is by aneurysm, which is when a weakened area in a blood vessel wall balloons out and bursts. Second is by arteriovenous malformation, AVM, which is an abnormal tangle of blood vessels in the brain that can rupture. Lastly is chronic high blood pressure, which can weaken blood vessel walls, leading to rupture. When this happens, the bleeding compresses brain tissue and disrupts normal blood flow, causing brain cells in the affected area to die. Brain cells rely on a constant supply of oxygen and nutrients from the blood. When this supply is interrupted, cells begin to die within minutes. Let's briefly go over some groups who may be more inclined to suffer from a stroke. Please keep in mind these groups are generally susceptible to strokes. If you fall within either of these demographics, it doesn't mean that you will suffer from a stroke. All it means is that you are at an increased risk. Also, if you fall within either of the demographics mentioned, it may be a good idea to get medically screened. Certain factors increase the risk of having a stroke. While some of these factors are modifiable through lifestyle changes, others are beyond an individual's control. Here's a breakdown of who is most at risk. Risk increases with age, especially after age 55. However, strokes can occur at any age, including in younger adults and children. Men are at a slightly higher risk of having a stroke than women. Women are more likely to die from a stroke, and certain risk factors like pregnancy, birth control pills, and hormone replacement therapy can increase a woman's stroke risk. African Americans have a higher risk of stroke than other racial groups, partly due to a higher prevalence of hypertension, diabetes, and obesity. Hispanic and Native American populations also have elevated risks compared to Caucasians. Individuals who have had a previous stroke or TIA are at significantly higher risk of having another stroke. Lastly, certain genetic conditions, such as sickle cell disease, increase the risk of stroke. There are many other risks that are associated with strokes. Please speak with your healthcare provider for more details. Now it's time to wrap up our video on strokes. We covered a great deal of information. Rewatch this video as many times as you need to and speak with your healthcare provider about any concerns you may have. The goal of this video is to empower you with a basic understanding of what strokes are and what causes them. Let's go over what we covered. A stroke is a medical emergency that occurs when the blood supply to part of the brain is disrupted, either due to a blockage, ischemic stroke, or a ruptured blood vessel, hemorrhagic stroke. This interruption deprives brain cells of oxygen and nutrients, causing them to die rapidly. Strokes can lead to significant and often permanent neurological damage, affecting speech, movement, and other essential functions. Quick medical intervention is crucial to minimize the damage and improve recovery outcomes. Individuals most at risk for strokes include those with non-modifiable factors such as older age, male gender, a family history of stroke, and certain racial and ethnic backgrounds, particularly African Americans. Modifiable risk factors such as high blood pressure, diabetes, smoking, obesity, and an unhealthy lifestyle also play a significant role. That will conclude our video on strokes. Feel free to like, comment, share, and subscribe to our channel. Thanks for your support. We really appreciate it. Please continue to support our channel. One way to show your support is by giving us a like. Stay tuned for our next video coming soon. We hope to see you all in the next one. Until then, see you soon.